We're live. Assalamu alaikum, everyone. Welcome to CARE's The Daily Dose, another edition. I'm Danette Sagari Mass, nonprofit attorney at CARE, and your host this afternoon. This is a daily program, and we hope that you're going to come back again and again every day here in Ramadan at 3 p.m. Eastern Time. We'll also replay this video in the evening on our Facebook page, so check that out. CARE has expanded its programs to include this, The Daily Dose, to bring you closer to the people and the stories within our community during this pandemic and trial for our community. Ramadan Mubarak to all of you. Inshallah, your homes are full of barakah, renewed direction and closeness to Allah subhanahu wa ta'ala. Inshallah, you're enjoying your thought away of prayers and breaking your fast with some friends and family, or at least connected through Zoom chats and other ways of reaching, through technology to be together like we are today. All praise belongs to Allah. Through His mercy, we have the blessings of this wonderful month, and we have the blessings of people today like Dr. Tori and Omar Ilyas, who are going to come on in just a minute and share with us some of the news of their communities, about the work that they're doing, that they're engaged in to help people through crises. And we know that this is a time where people who are already in crises really suffering right now to access basic resources. We see the long food lines, cars lined up to just get basic necessities at food banks and whatnot for their families. People are losing their jobs, and the economy really is causing a lot of panic. And some people for the first time reaching out for resources where they had not been in a position of need before. So the people today are going to talk about how they're helping people work through those problems. Dr. Tori is with us. Dr. Ed Tori, who lives in my community, mashallah, is the director of the Influence Center at one of the largest healthcare systems on the East Coast. He assists associates with learning the science of persuasion for better communication, improve care delivery, and behavior change. He speaks on influence and persuasion across industries, anywhere people are doing good in the world. There's a lot that I could say about Dr. Tori. He made me promise not to read his long bio, but really it is a long bio. He's also the president of the Islamic Society of Baltimore, a much beloved person in our community. Are you there, Omar? I'm sorry, Dr. Tori?
Yes, I am. Assalamu alaikum wa rahmatullah.
Assalamu alaikum. We also want to bring on Omar Ilyas, who is a graduate of the University of Michigan with a bachelor's degree in public health, specializing in international healthcare policy. He has published several international healthcare journals and has spearheaded initiatives for the betterment of disenfranchised communities, including refugees and those informally incarcerated. He is particularly invested in healthcare development within Pakistan. His work has awarded him the Dr. Martin Luther King Jr. Spirit Award at the University of Michigan, as well as recognition for his commitment to service by the University of Michigan School of Public Health. He is currently working as a United Nations team member representative to the American Pakistan Foundation. But the reason we're bringing him to speak with us today is that he co-founded a project called Paani Project with a few friends at the University of Michigan. Are you there, Omar? How are you doing today? He's not with us yet. We see Dr. Tori. Dr. Tori, when we were earlier having a conversation, everybody was just complimenting your background. I mean, I think that's the best background we've seen. I'm very jealous of your background.
Well, you have to make a sort of a little kid-proof bunker when you're going to have all these video calls. So
yes, yeah, you've done a good job. It looks great. It looks great. How are you, Omar?
Assalamu alaikum. Doing fantastic. Alhamdulillah. What about you guys?
You've done so much in your young life, mashallah.
Alhamdulillah. Thank you so much.
So, Dr. Tori, I want to ask you, the Islamic Society of Baltimore, ISB, has sustained involvement in the community in quarantine very effectively. Can you talk about some of the ways that, and some of the initiatives that leaders at ISB have been able to sustain the community and meet needs, meet people where they're at?
Sure. So, A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Assalamu alaikum to everybody. Ramadan Mubarak. So the Islamic Society Baltimore, fortunately, we formed an ISB Healthy Task Force very early on as COVID started to surface. And they provided guidance for our community, our leadership, and on how and when to prepare. So alhamdulillah, we were able to virtualize a lot of our efforts early. So we have multiple schools, Al-Rahma School, Al-Rahma Sunday School, Al-Rahma Quran Academy, Al-Rahma Nursery. We were able to virtualize most of them in pretty early. So we were able to start training early. And so one way to keep involvement with the community is to make sure that the schools stayed open and stayed active. And so it was a big heavy lift, but alhamdulillah, our teachers all stepped up very early, working extra hours early on to get those up and running. By the way, it is Teachers Week, so we should give a shout out to all those teachers. So anyway, there you go.
Appreciate that more than ever.
Sure. And then other programs also were virtualized. So whether it's general updates to the community, we have a massive construction project that's ongoing, so providing updates there. We have general body meetings, those sort of things. New shahadas, when able to, we are able to broadcast those to the community. Some of the more social elements to keep people engaged, we have game nights that actually get a little bit heated between families on Friday nights, and those have continued through Ramadan. We are crowdsourcing Ramadan cookbooks. We have sort of exercise and workout videos and all those things to sort of keep people engaged as we all are trying virtually with video and etc. And then also planning for creative alternatives coming up for things like graduations and all of that, because we're coming into that season. So how do we prepare for that? And then we, as Ramadan started to unfold, we converted our ISB Live channel into an all-day channel. So starting before Fajr and ending after, when say middle of the night, it's an all-day channel. So everything from kids programs to teachers reading story time to Mufti Bank doing Sirah of the Prophet Sallallahu Alaihi Wasallam, and lots of different programs, of course, Quran recitation, adhkar, and all that to keep people engaged.
Quran recitation at ISB. I have to say,
mashallah.
Oh, wow. It's amazing how you're bringing people together through technology and doing game night, did you say? It's important for families to be connected together, because this is a month when we are used to visiting, we kind of, if we don't get together with people at any other time of the year, we make time to do it in Ramadan. So it's weird to be doing Ramadan this way. So how do you do game night virtual?
So there's an app called Kahoot where you can sort of log in, and so there's a team of volunteers that are preparing questions behind the scenes, and then you have a certain amount of time to ask a question, and there's an app on the phone where teams can hit the phone, and so essentially when they tap the app and the right answer, you're scored based on timing and correct answer, and then teams sort of rise up to the top. And it's kind of cute because you start to see some halal trash talking and stuff like that. So anyway,
who's really competitive in the community.
Exactly right. And the differences of opinion that come out afterwards when people start complaining about some of the questions, but it's fun.
Really fun. Sense of competition and who needs some help.
Right.
By the way, Dr. Tori is, there's lots of doctors, right? But Dr. Tori is a medical doctor. What is your specialization, Dr. Tori?
Internal medicine.
Okay. I also wanted to ask Omar some questions about Paani. I know it started off as a student organization. How has student organization grown to help so many people internationally? Like, how did you start from, there's lots of student organizations, but they don't all become international relief organizations. That's very
No, alhamdulillah. I think so. When we started off, we're now a full-fledged 501c3 nonprofit. But when we started off, we were just a student organization at the University of Michigan, and in response to the growing water crisis. And we always tell the story, but we started almost in the middle of exam season. So exams were happening. We're sitting down. We're arguing about what is the minimum grade we have to get so that we can pass the class. The usual stuff. And within that, someone brought up an article saying, that highlighted that Pakistan is going through a huge water crisis. We recognized everyone there was a child of Pakistani immigrant. We are children of Pakistani immigrants. And so we recognized that, our parents grew up in Pakistan. It was a country that raised them and nurtured them. It provided them a platform to grow. And then they had to leave all that to come here for us, right? And so there's that sense of responsibility that started growing on us that, listen, alhamdulillah, we've reached a position, we're going to an amazing institution. We have access to so many different resources. How can we leverage that and those connections to giving back, right? For a lot of us, it was almost like Pakistan had become a place for our childhood summers, right? It was something almost compartmentalized as a place that we had fun, right? So we derived a lot of fun hanging out with cousins, eating street food, getting sick from street food, all that stuff, right? And so it was time for us to kind of take a new look and a new approach towards it. Like, instead of deriving so much enjoyment, how can we give back? And so I remember the first thing that we thought of is, what if we just sold donuts? And we started selling donuts at like a $1 profit margins to raise enough money for our first well. It took us 3 months.
Wait,
We were
this is
selling them
in
to students.
Michigan.
This is at Michigan, yeah.
Okay.
Our first well was literally built off of donuts. I mean, alhamdulillah, it worked out for us, right? And so
Awesome.
and so I think once that was built, it was
So wait,
the
one
first time.
second. So street food, you mentioned street food in Pakistan and associating that with a positive memory. And then you take the street food, it sounds like, to the US and sell that to develop projects in Pakistan.
Almost. We kind of took that same philosophy and did it here.
Wow, I love it.
Except the street food here was definitely a lot more, less contaminated.
Yeah.
And so I think when we moved from that, when we saw the tangible impact that we were able to create just by building one well, it was really the first domino in the next domino effect that started happening. We started realizing that if we moved past these brainstorming phases and started moving towards execution, we actually had the power to do a lot more than we thought. So alhamdulillah, since then, I think we've built over 300 wells. We've funded schools, we've built educational curriculums.
300 wells? Started from donuts, mashallah.
Yeah, no, alhamdulillah, there's a lot of barakah from Allah to make us do that.
What does one well, what does the purpose of one well? Like how many people does it serve? What needs does it serve?
So it depends on the well, right? So there's basic hand pumps. Those can serve 50 people simultaneously, right? So 50 people can go one by one, and they can all get access to it. There's some bigger ones called deep water hand pumps, which can serve 200 people simultaneously. There are even bigger ones, solar wells, that can serve like 10,000 people. So it really depends on the amount of money you want to contribute. But alhamdulillah, I think we've been blessed to have the opportunity to even have our own teams in both areas in Pakistan. So it's really nice to be able to know exactly where all the money is going.
And if people want to contribute to building a well right now, where would they do that through Paani? How can they find you?
So you can find us on our social media at Paani Project, or you can go on our website, paaniproject.org/donate. And it should be right there. There. It says donate now. Perfect.
So Paani Project, Paani Project. Okay, great. Great, mashallah. That is a fantastic, very unique story and very inspiring for our young people.
Thank you.
That's a tough act to follow, mashallah. I want to go back to you, Dr. Tori, because I know that besides all of the, mashallah, social interactions that you all are facilitating this month to try to bridge the gap, and by having your 24-hour, is it 24-hour channel or?
Most of the day, not 24 hours.
Some people, you have to sleep at some point, right?
Yeah.
So we'll give you that.
Thanks.
But there's other things that the community has been doing too. I think you talked about earlier, drive-by iftars, a call-in, drive-through iftars, blessing boxes. Can you talk about some of the other humanitarian work that you all have been engaged in?
Sure. So first, I have to say that all this talk of Paani is making me thirsty. Thank you very much for that, Omar. So some of the things related to some of the efforts around serving the general community and specifically local Baltimore community revolve around efforts related to COVID outbreak, and some related just to general needs, and then others related to Ramadan itself. So we have partnered with a few organizations. One in terms of some of the health needs. I mentioned the ISB Healthy Task Force. As part of that, we have a free clinic that provides services to uninsured and underinsured. And while some of those folks are no longer physically in the clinic, we do have a My Nurse program. Now, some of the clinic's efforts are funded by a generous grant from Islamic Relief. And so that is allowing us
relief, mashallah.
Yeah. And so they're helping us in that regard with some of our healthcare efforts. And then when it comes to other efforts, we have another partnership with ICNA Relief to deliver blessing boxes. Those blessing boxes are essentially staple sort of items that you would need in the home that are not perishable. They might be, flour, sugar, oil, detergent, things like that, where our community is sponsoring. So people can purchase a box for $50, and then they're being distributed by a group of volunteers, which are made up from volunteers in and around the Baltimore community, and largely with a huge effort from ICNA Relief and the ISB community. And so essentially that's a drive-through process. On Sundays, people drive through, pick up their groceries. We load them into the trunk, and then they drive off. next person comes. And there are some where we deliver when people cannot leave the home. Like, so for example, if they are ill or elderly or socially isolated. So there are a few where we're able to deliver. Of course, also in this time of stress and uncertainty and job loss, we also continue to offer counseling services and also partner with ICNA Relief on that, as well as the Muslim Social Services Agency, which works out of Baltimore. As it relates to Ramadan itself, we have started drive-through iftars. So the drive-through iftars actually serve multiple functions. Obviously, there's the benefit of feeding the fasting person, and inshallah, the reward associated with that. But at the same time, we are supporting local Muslim businesses who are also hit by the current crisis, right? So essentially, sort of a food truck or a restaurant comes in, brings all of the stuff to serve a drive-through iftar, and then that actually serves also other functions.
You can like you can purchase the food from the vendors
No,
there.
It's sponsored by our community. So donors are
helping business. Yeah. Okay, great.
Yeah. So donors are sort of sponsoring the iftars. The more that is sponsored, the more days we offer. So initially we were only going to offer Sunday because we weren't even sure people would come through. But in this past week, we've had to increase it to Friday, Saturday, Sunday, because the donations for iftar sponsorships are flowing in. The other thing that's been beautiful is that, and this is part of it, like you get to see people and you look in there, you know, I mean, obviously we're wearing masks, we're doing the social distancing thing, but you're seeing people you haven't seen in a while. And not only that, as they drive by ISB, they see the construction has really progressed. And so they get excited about when they come back to school, when they come back to all the programs, that it's going to be a completely new facility. So lots of benefits for that. We also have had lots of sort of drop-off services sort of periodically. So we may bring food to our local neighbors, Muslim, non-Muslim, doesn't matter, just bringing food to them as a gift, also to first responders, to police, fire department, EMS. So, you know, wherever we can, able to do that. This coming Saturday, May 9th, was normally going to be our in-person fundraiser. We've decided to do essentially online and outside. So there's an outside component where you drive through. You know, we used to get around 2,000 to 3,000 people on that day. So this time we're going to be providing food where people can drive through. If they want to drop off a donation, great. If they want to donate online, great. If they want to pledge, that's great. But all the while, just come break your fast on this Saturday. So
this Saturday,
May 9th, starting at 5 p.m., people can start picking up food, as well as tuning into ISB Live. We'll have speakers from all over you know, the country and the world, and local. So
people who want to support ISB right now, we're hearing about all the exciting work that you're doing. Where do we go to do that?
Yeah, thank you for asking. ISB, it's isb.org. Essentially, if you go there, you can find whatever you want to particularly to give toward, isb.org. And it's isb.org/donate in particular. And I would say also not just giving for the sake of the construction project or the school or student sponsorship or iftars, but also keep in mind your zakat al-fitr. The sooner you give it, the sooner we can distribute it to the Baltimore community. And so, you know, it's so please, yeah, if you can, yeah, it would be deeply appreciated. You can go there and select.
Right there.
What's that? You can go there and just select the category.
Up there. Good job, Ayan.
Oh,
She does. She's in the background here. Ayana G. Things running, mashallah.
Mashallah.
Thank you so much. I want to go back to Paani, if that's okay for a second. I'm referring to you now instead of Omar as Paani.
It's all good.
She's thirsty.
I like the name.
She's thirsty, bro.
I'm hungry after hearing all the food talk, guys.
So how is Paani helping Muslims affected by COVID-19 pandemic? Have there been any changes to your usual operations? Do you have to adjust to the evolving needs of the Muslims that you help?
Yeah, no, so I think it's important to recognize that Paani is a fundamentally humanitarian organization, right? So Paani literally means water. And so we started to build the wells because that was the most pressing problem that Pakistanis were facing. And so when the pressing problem shift, it's important for humanitarian organizations to adapt and change with that, right? So new pressing problem, it's not that water is solved. It's not like people have water all of a sudden, but now in conjunction to water, people need food. And so, alhamdulillah, what we've been able to do is we've been able to raise a lot of money and work with our teams on the ground to distribute, I think, food to around 7,000 people. And so it's enough food for about 1 month, and it's for daily wage workers. So we've been able to do that, and that's primarily the work that we're doing right now.
So kind of like ISB getting down there on the ground, people
Yeah.
can drive through and get their food. How do you get the food to the people that need it? Do they
Yeah.
know where to, where to go to? Do you have certain location sites and centers? How does that get set up?
So because of that, we work in a lot of the rural areas of Pakistan. What we have is our team will go down fully equipped with masks and PPE and all that. And they have these boxes filled with like rice, with flour, with everything you need to make a meal, right? Enough for about a month's supply. And they'll come down and drop off these boxes and people can come by and pick it up. And so it's really funny because like when you look at like the way the lines are set up, there's like circles drawn on the ground where people have to stand 6 feet away from each other. So it's a really weird system because it creates like an insanely long line. But it's nice. I mean, alhamdulillah, I think it's been able to keep up with both the World Health Organization's recommendations and still be able to provide food to some of the people that need it the most.
So you're meeting needs on the ground. You're making sure that you're also doing it in a way that doesn't, cause or aggravate the situation, cause more COVID to spread. So that's really brilliant, mashallah. So I didn't know. People will think maybe Paani is doing water, and that's enough. Building wells. But actually, mashallah, now serving other needs through this pandemic, getting on the ground and giving people the food boxes. Dr. Tori, there's something there as well with ISB. What is your role with care for the caregiver? How do you provide emotional support? And what does that look like? Because we're talking about, the hunger, the thirst, the physical needs. And then there's also, the emotional well-being, which a lot of people are feeling impacted right now.
Yeah, so there are two parts to that. Care for the caregiver references something that I do professionally. So ISB is providing counseling services by way of behavioral health professionals, partnerships, as I mentioned before, and sort of religious leaders and spiritual leaders. So that is ongoing and certainly increasing in need, as you can imagine. When it comes to care for the caregiver, that is something where it's a service provided where I go into, I and a team of volunteers, whether they are nurses or physicians or certain other healthcare providers. We go into areas where they are delivering care related to COVID, to COVID patients, where the stress is high, the overwhelm is high. And it's important to note, first of all, that even before COVID hit, there was a big push inside of healthcare to recognize burnout inside among nurses and physicians and therapists and everything. So this care for the caregiver program was essentially designed for pre-COVID times and to address the emotional needs. So it provides frontline sort of emotional support. And then of course, if there's deeper professional needs as far as behavioral health or even psychiatry, then they're referred on. But I'll tell you that when you go in on the front lines, and let's keep in mind, lots of the Muslims. So right now you're talking to two essentially representatives of organizations, but there are lots of Muslims that are serving as individuals on the front lines. They are in every health profession, and they are, and they are teachers, and they are moms, and they're just, so it's important to recognize them at this time, and that they have these emotional needs as well. Also, in addition to it being Teachers Appreciation Week, it's also Nurses Week. So I would say that after moms, right? Like after moms, like nurses and teachers, like everyone else, but so there's such an important part. And so what we do is essentially help them through the tough emotional times. And so we go and we do sort of what we call wellness rounds, where we actually go on to those units. We also identify wellness spaces where, so for example, since people cannot visit their loved ones, the patient waiting rooms are now empty. So we've converted those to wellness spaces so that when people need to just get away, get a breather, seek someone to talk to, or other resources, we've converted those, or we're in the process of converting many of them into those. So just to essentially provide that frontline support.
Space in another way to dispatch resource. Actually, that sounds like you all had already set it up even before COVID-19, but you were able to quickly dispatch it into meeting this new need, this crisis. Wow.
Yeah.
Incredible. So when people go in, how are you going to make sure that, like Brother Omar, with the circles and making sure people are 6 feet apart? How do you provide emotional support from a distance, even though people are in the same building? They can't really be close together.
Yeah, so sometimes we'll have group Zoom calls for sort of, just check-ins with the group. Sometimes we'll do it one-on-one, sometimes calls, but actually the most effective has actually been in person. So go in there fully on full PPE gear and actually just sort of help. I mean, so what many people don't realize is that the health systems are deeply constrained by I mean, and small things. And I'm fortunate to work for a very large health system that can redeploy people and redeploy assets when needed. But on the very front lines, there are small things where a nurse might be in a room and completely gowned up and needs something outside, and would have to, undo all the PPE, get out, take the time. And so just being there to provide even some of the small support, and also keeping in mind that a lot of times, especially in nursing, there's a focus on the other. And so you get compassion fatigue. And many times they're so busy, they're so overwhelmed, and they're so other focused that they don't even realize it until you say, hey, how are you? And then they say, I'm fine. And then they say, no, how are you really? And then they break down. And I mean, it's just something that like, I'm going to try not to get choked up. So I'll leave it at that.
Yeah, they get a release and then they can get back out there and meet those needs. That is incredibly difficult. Mashallah. And you wearing so many hats. I don't know how you're putting them all on. Mashallah. Allah's put a lot of barakah in your time, clearly. Which is, the more you give, the more Allah subhanahu wa ta'ala gives to you in terms of your ability to meet needs and to think of new and creative ways to meet them. So how do people get involved? I want to ask both of you this question. So a lot of people are going to watch this video and think, wow, I want to help Paani, or I'm in the ISB community, or maybe even I'm farther away, but I love what they're doing, so I want to support them. Let's start with Omar. How can people get involved, both for you locally and internationally?
So I think there's a lot of different ways to be involved, right? There's a lot of moving parts in a nonprofit like this. So the easiest way, and I think the lowest level, I think, is just sharing and making dua for us. I think that's not even the low, dua is probably the best thing you guys can do. But aside from that, if you can donate or even share some of the information that we have out there. So our launch good is paaniproject.org/Ramadan. That also has a lot of information on where the money's going. It breaks everything down. It has pictures of every time we've donated the money and the money goes someplace. So alhamdulillah, stuff like that is probably the best way to do. But aside from that, if you can share the information to your local communities.
Donate. If you're stateside, if you're going to build those wells, we have to pay for them, right? Provide those boxes.
100%, yeah. And especially since we don't keep any money for overhead costs because everything is volunteer based, every dollar counts, right?
Yeah, that is great. MashaAllah. I can't say how I'm so impressed that you're doing this at this age. And I'm a mother of a young man. And so MashaAllah, I'm going to play this video for him later. So.
If he wants to join Paani, he can join too.
He's doing a great job, great to get inspiration. MashaAllah, I think you're following, it sounds like, in Dr. Tori's footsteps. MashaAllah.
Inshallah, man.
Allah puts wonderful, beautiful people in every community. I travel a bit for the work that I do, and I notice that there's good people in every single community. Allah puts them there for a purpose, to meet a specific need, and they find happiness through serving that need. Finding your purpose is so important to having joy in life. So I'm glad that at such a young age, you have your purpose and you're fulfilling it so beautifully. MashaAllah. So what about Dr. Tori? What about you? How do people, we talked about donating, so we've led people to the website. How about people helping out on the ground? I think probably people are concerned about coming into contact with the illness, probably. Are there people that you recommend don't come in? Or, if they want to come in, how can they help?
Yeah, so in general, most of it, essentially everything is closed to sort of access. So people can't necessarily just come to ISB and take part. We actually have a very sort of organized process of who is volunteering on which day at which time, so that we don't exceed the governmental regulations. And then also we maintain safety for all the volunteers. So I would say the best way is probably to just simply stay in touch with ISB through isb.org. Also, the ISB's Facebook channel is a place where there's lots of times where when something's going on, it's being broadcast, and or a call for help to say we need volunteers, or sign up for this WhatsApp group and you can be a volunteer. So for example, with the ICNA Relief partnership with Blessing Boxes, when we need people to deliver things, the ICNA Relief has sort of a communication channel set up where they're sort of centralized people deploying people to different parts of the Baltimore region to deliver the goods. So, but I would say stay in touch via the websites.
Sorry, I say shout out to Naveed Ahmed as he's watching. I know he's the president now of ICNA Relief here locally. So that,
and Ibrahim Abu Sway is on the ground every day, like just taking care of stuff. So
these people come from the ISB community. MashaAllah, some of the leaders in the ICNA Relief organization grew up in and around ISB, which is really beautiful. So the work that you are doing now, like I said, Omar, really being an inspiration to other people who grew up within these institutional frameworks. Inshallah, we're producing people who have humanitarian hearts and grow up and look for ways to meet and step into these big shoes, inshallah. So thank you so much for coming on today, both of you. I know that you're incredibly busy. I can tell by the projects that you described. It means a lot to us that you would give some time out of your Ramadan day, especially to come and talk about this work. And I hope that the people who are viewing this go to these websites, check out what you're doing, support the efforts and the hard work that you're putting in, inshallah.
Thank you so much for having us.
Thank you very much
for coming.
Assalamu alaikum.
And to our viewers, I just want to remind you of our care.com website. You can find out about all the great work that we're doing there. And we have a new website called carenewsroom.com. You'll find so much information. You're going to know every day what new shows that we're going to be playing for you at 3 o'clock every day, the different guests that are coming. We have a dashboard there from Johns Hopkins University, so you can stay up to date with what's going on with the COVID virus around America and around the world, and even in your region. We have a section called Just the Facts. You can go there right now and find out news that you need to know that's regularly updated. We have a beautiful community response section, which is operates as an information site and also a blog providing information. We have a spirituality section where now we have a great article up there called Reframing Ramadan, How to Flourish While the Masajids Are Closed. And then even we have an expert section, which we're always looking for people to contribute to, actually. So if you have an expertise and you'd like to share that, please contact us. And if you have a question for an expert, also contact us, because we'll try to locate the experts to answer those questions. Right now, if you go on, you'll find a contribution from our own attorney, Gadir Abbas, who has an article called How the FBI Questions American Muslims. So there's just a wealth of information. You can also find all of these shows, the whole library of all the Daily Dose shows that we've done since this show began. So thank you so much for spending your time with us today. Thank you to those who support CARE. We exist because of the support of the community. We're an extension of the community. If you haven't donated to CARE yet, please go to our website, www.care.com, click on the donate. Every little bit helps, provides representation to people who need civil rights legal services, and make sure that our community is civically engaged and understands what are their rights, and a plethora of services that you can find out actually if you go on our website. We meet a lot of needs in the community. That's all I'll say for now. I hope you'll join us again tomorrow, again, 3 p.m. Eastern Time, the Daily Dose every day, and we'll replay it in the evening. Take care, everyone. Assalamu alaikum.